Any one woman or girl dying or becoming disabled from an unsafe abortion is one too many. Dr. Jaydeep Tank, obstetrician and gynecologist. So, should women be allowed to have access to abortions legally? This is a heavy question, and there are numerous variables and factors that should be taken into consideration when discussing a topic this controversial and serious. However, there are three main points that I would like to inform you about today. Abortions are a safe procedure when done correctly, the abortion rate is declining due to easier access to birth control and contraceptives, and doctors all over the world must base their decisions regarding this topic on their legal liability. Now, I've done my research and have credited reliable sources, so let us dig deeper into the main points of this speech. I stated that abortions are a safe procedure when done correctly. Now, what I mean by this is that abortions are safest when done by a professional, a doctor, and in a safe environment, a hospital or a clinic. I say this because there are a lot of women who get abortions illegally and unsafely, which can cause complications and serious injuries. Be that as it may, safe abortion procedures do not cause a future risk of infertility or ectopic pregnancy, miscarriages, birth defects, or preterm delivery. Stated by Dr. Sarah Prager, obstetrician, gynecologist, and professor. To continue, the mortality rate associated with legal abortions is 0.7 deaths for every 100,000 procedures, making it safer than childbirth and other common surgeries such as colonoscopy, tonsillectomy, and plastic surgery, also stated by Dr. Sarah Prager. To end with, there is only a 0.4% risk of complications when medication abortion pills are administered. Therefore, there is a lot of hearsay when it comes to how abortions can affect a woman in the long run, but it is medically proven that it is a very safe procedure. Now let's talk about the declining abortion rate due to easier access to birth control and contraceptives. According to the CDC, there was a 1.5 decrease in the number of abortions per year, and they are continuing to decrease at a slow and steady pace. Going hand in hand with that, between 2017 and 2019, 65% of women between the ages of 15 and 49 were currently using some kind of contraceptive method. Also cited by the CDC, there were annually 1.6 million abortions in 1990, and in 2020, there were 930,000 abortions, decreasing by 670,000. That is a big difference in the number of abortions, and like I said previously, the CDC has proved that they are steadily decreasing each year. Finally, doctors must base all their decisions regarding this topic on their legal liability. Now, what this means is that since there are so many regulations and rules that coincide with abortions, it is hard sometimes for doctors to keep track of everything in their area and what is allowed and what is not allowed. As stated by Dr. Katie McHugh, we're trying to be very, very careful, especially as things are evolving. I'm sure that I have made a mistake. And it is so scary to me to know that I'm not only worrying about my patients' medical safety, which I always worry about, but now I'm worrying about their legal safety and my own legal safety. This is a problem for doctors all over the world, and it is hard on them because they are having to worry and stress about other problems rather than only focusing on their patients' needs. To conclude, should women be allowed to have access to abortions legally? Abortions are a safe procedure when done correctly. The abortion rate is declining due to easier access to birth control and contraceptives, and doctors must base all their decisions on their legal liability. Like I stated previously, it's a heavy and long topic with a multitude of factors to consider when thinking about it. It all depends on how you choose to perceive it. Thank you.